Thank you, Mr. Chairman. I thank you for the hearing today, and I have to agree with you. Medicare Part D is very popular with seniors. A majority of beneficiaries not only participate in Part D, they express satisfaction with the program, and it is definitely working the way it was intended. I join you in being very concerned about the rule and the proposed rule. This is something that would not serve groups well, certainly not my seniors in Tennessee. There are over 250 groups, which include patients and physicians, that oppose the rule. And I would like to submit a letter from an organization, Centerstone. Submit that for the record. They provide mental health care in Tennessee.
Without objection,
and I
so
thank
ordered.
the gentleman for yielding the time, and I yield back the balance of it. Thank you, Mr. Chairman. Thanks, Mr. Blum, for being here. Avalair has said that the changes you're going to make would eliminate 39% of all of the enhanced plans by 2016, and that would be 214 of the current 552 enhanced PDPs to be terminated or consolidated. So, what would you say to the seniors in my district who like the plan that they have but cannot keep it if you get your way?
So, a couple of things, Congresswoman. First is that CMS since 2009 has put in place a strategy to reduce the number of kind of extra plans that sponsors provide. When we started that process back in 2009, 2010, we heard
You're doing this through the rules.
Correct.
Okay, let me ask you this. Avalair also said that the regulation would impact 7.4 million of the 7.9 million Medicare beneficiaries who are enrolled. That's 94%. So why would you and the President support a regulation which is going to disrupt 94% of seniors in Medicare Part D who have a plan that they like and would really like to keep it, but you're not going to let them do that?
So I think it's important to think about the history of the marketplace. Before the donut hole was closed, Part D plans oftentimes offered kind of supplemental benefits to fill in that donut hole. The donut hole is now being closed due to the Affordable Care Act. By 2020, the donut hole will be completely closed. There have been very strong steps so far to close that donut hole. We see little opportunity for Part D plans really to distinguish themselves from other plans those same sponsors offer.
So you see this as an opportunity?
We see this as a way to simplify the Part D program, to make it much more easier to navigate.
So by limiting choice and options, you see that as a simplification and a way to improve this program?
And I think some of the concerns that I hear oftentimes from the beneficiary communities that there is many Part D choices, too many to choose from, and we know from academic literature that the more choice, more confusion.
So you think people are confused?
I think
that seniors are confused and they need CMS to simplify this?
I personally hear tremendous confusion from the beneficiary community.
Let me ask you another question. You've talked about actuaries a lot. Are you listening to actuaries or enrollees?
We listen to both beneficiaries
to both. Okay.
And to our career actuaries.
Okay. Well, you know, the surveys show that 95% of the seniors are satisfied with their plan, and Part D is estimated to cost 48% less than initially estimated by the CBO, and Milliman has projected that if your new rule goes into effect, the federal government will be on the hook for $1.6 billion more than expected in 2015. So where are you going to get the money?
So I think a couple things. I think we see a future for the Part D program that is growing very quickly, 10% per year. That is dramatically faster than other parts of the program. Okay. So to say that we shouldn't take a critical look at the future, we don't agree. We heard the same concerns back in 2010 that premiums would skyrocket, beneficiaries would be left by their plan when CMS started to consolidate.
Yeah, we heard that about the Affordable Care Act, and that indeed is happening. I tell you, I have plenty of stories I can share with you there. Well, if Part D is not broken, then why do you think you need to go put something in here that's going to cost more, limit options, take seniors out of their plans? You know, it doesn't make a whole lot of common sense, Mr. Blum. And I think that what we would like to do is see seniors who have a product they like, they're satisfied. Bear in mind, Medicare is something seniors have had money coming out of their paycheck every day of their working life and going into a Medicare trust fund. And they have prepaid their participation in this program. And I think that CMS needs to be listening to those enrollees and maybe paying less attention to these actuaries that obviously are going to give you. Let me ask you this, what's your goal? What are you trying to achieve by this? What's your outcome?
I think we have several goals. We want to reduce the prescriber fraud in the program. We want to make the benefit less confusing, more clear to our beneficiaries. We want to make sure that when the program pays the majority of costs for low-income beneficiaries, that we're paying the best possible rate. When we see preferred pharmacy networks being created, we want to encourage innovation, okay, so long as those cost savings get passed on to our beneficiaries, passed on to the taxpayers.
Okay.
So Part D, yes, has been tremendously successful, but we do not think it's perfect, nor do we get that
My
feedback.
time has expired. One last question. Can you cite for me the statute that gives you the opportunity to go in and settle these disputes between the manufacturers and the pharmacies? Yield back.